Patients were getting increasingly upset. I was becoming extremely frustrated, overwhelmed, along with many others working in the infusion suite.
The infusion suite is an area where there is a fixed number of beds and nurses, and with an increase in volume, we really needed to be a whole lot more efficient and timely in delivering the care and treatment needed by our patients to accommodate the increasing demand. One of the specific opportunities that have presented itself to us in our assessment of the infusion suite is the way in which our patients were assigned to the nurses who were caring for them throughout the course of the day. Patients were not necessarily arriving in the infusion suite at the appropriate or appointed time. One patient would come late, one patient would come on time, another patient would come early, and the nurse would find him or herself in a situation where 3 patients were arriving at the same time.
It was an intense place to be, an intense place to work, and the pressure was on from the minute you walked in the door until the minute you left, and you never left when you thought you were going to leave. And just exhaustion, mentally, physically, emotionally, just every day. It was I didn't want to be a nurse anymore, and I didn't like feeling that way. Once I had gotten past that and decided that I need to be a part of fixing this, I can't complain if I'm not going to make an effort to fix it. And so that's when I decided to approach Melanie and asked her to basically help me turn this around, please. We collected data about the number of patients coming through their treatments, how long they were taking, when they were arriving, when they were leaving, as to when they were scheduled as well, and just looking at the big picture, what happened, what is happening here that's causing these problems.
Sara took charge of it. She initiated it, she maintained it, she has the responsibility for it. And as a staff-led initiative, I think that holds much more weight with the other members of the Infusion Suite team than if this was some sort of dictate that I was handing down to them.
The solution we came up with was to assign patients as they came in. Patients show up, charge nurse checks them in, checks the orders, and then assigns it to a nurse. It actually increases efficiency because we're caring for them when they're there and they're ready to be cared for. Also, nurses have single task assignments, so they're bringing in that one patient. They're not worrying about the next one. They know they're not going to get another patient until they're ready.
Since we've implemented this program, both patient and family satisfaction has increased. The patients have asked us repeatedly if we have hired more staff because they get to see more of the nurses. We're doing more work with the same number of staff. There is more teamwork within the staff. The patients are getting more intensive nursing care. We could not have done this without the help of the quality group within the hospital. Evelyn Schlosser was so key in her guidance through this whole process.
If you've got leadership who are advocating for nurses, wanting a culture of change, and know that it's important that nurses are involved in that when it affects them, that's the key.
For this particular project, we have in essence created more capacity with fixed costs, so we can care for more patients without an increase in staff and without an increase in space.
I never knew I had this in me. It took that opportunity to be able to do what I've been doing, and now I want to do more of it.